Hello and welcome to Take Your Medicine. On today's show, we will be discussing depression. So, what is depression? Depression is a mood disorder that makes you feel constant sadness or lack of interest in life. Most people feel sad or depressed at times. It's a normal reaction to loss or life's challenges. But when intense sadness, including feeling helpless, hopeless, and worthless, lasts for many days to weeks and keeps you from living your life, it may be something more than sadness. You could have clinical depression. You may have depression when you have 5 or more of these symptoms for at least 2 weeks. Your mood is depressed for most of the day, especially in the morning. You feel tired or have a lack of energy almost every day. You feel worthless or guilty almost every day. You have a hard time focusing, remembering details, and making decisions. You can't sleep or you sleep too much, almost every day. You have almost no interest or pleasure in many activities nearly every day. You think often about death or suicide, and not just a fear of death. You feel restless or slowed down. You may have lost or gained weight. And you may also feel cranky and restless, lose pleasure in life, overeat or stop feeling hungry, have aches and pains, headaches or cramps, sometimes digestive problems that don't go away or even get better with medication. You may also have sad, anxious or empty feelings. While these symptoms are common, not everyone with depression will have the same ones. How severe they are, how often they happen, and how long they last can vary. Your symptoms may also happen in patterns. An example is depression may come with a change in season. This condition is formally called seasonal affective disorder. It's not uncommon for people with depression to have physical signs of the condition. They may include joint pain, back pain, digestive problems, sleep trouble, and appetite changes. You might have slowed speech and movements too. The reason for this is the brain chemicals linked to depression, specifically serotonin and norepinephrine, play a role in both mood and pain. So now you may ask, what causes depression? Doctors haven't been able to pinpoint the exact cause of depression. They think it may be a combination of things, including the brain structure, brain chemistry, hormones, and genetics. There are many different types of depression, and many times depression is classed according to medical findings after consulting with a doctor or specialist. The two main types that I see in practice is patients with mild depression. This is when you feel sad for a prolonged period of time, but still manage to function in your daily lives. A doctor would commonly prescribe a drug class such as a serotonin selective reuptake inhibitor, such as fluoxetine, which will then boost the feel-good hormone serotonin in the brain. If it's more anxiety related, then a drug like diazepam, which is a benzodiazepine class drug, which helps to calm and relax a patient who is feeling stressed or anxious, may be used. For patients with major depression, which is when a patient is so sad that they can't function in society, doctors would use newer drug classes such as serotonin norepinephrine reuptake inhibitors, an example is venlafaxine, to boost patients' serotonin and norepinephrine levels to get them back on their feet, feeling good, and to be able to function in society again. Now in our next episode, I will be discussing the different medication used in depression and their side effects and indications. Thank you guys for joining me again. If you enjoyed today's show, please hit the like button and please subscribe to the channel. Thank you guys for joining me. Take care. Goodbye.